Hello friends, this is Shubham and today I'm going to talk about antidepressants. So before going into the detail of the antidepressant, we should know about the depression. So some words about depression. Depression is the term. It is used when it is used for those persons who are very sad and in that particular duration they are not able to perform any productive uh, work. So they are not able to perform any productive work at that in that duration, and they are very sad. In those people, actually there are the problems with the some neurotransmitters in the brain. So which kind of neurotransmitters are these? Actually, they are the problems, and even there are the low amounts of these neurotransmitters. These are serotonin, which is 5-hydroxytryptamine, serotonin, norepinephrine, and even dopamine. So if there will be the low amount of serotonin, norepinephrine, and even dopamine in the CNS, then those persons will be very sad, and this stage is known as the depression. So antidepressant drugs, they are against the depression. So how they work, that they will increase the amount of these neurotransmitters by the different mechanism of actions, and they will increase the serotonin, norepinephrine levels and some dopamine levels, so that the patient could be able to get rid of the depression. So antidepressants are mainly classified into the 5 stages. But before discussing those 5 stages or 5 uh, classes of the drugs, let me tell you the normal physiological conditions in the brain and what is the condition of these neurotransmitters physiologically, and then in the depression, in the patients who are suffering from the depression, and what happened to these neurotransmitters. So let's talk about that by drawing some neurons. So here I am going to draw the 2 types of neurons. One is the serotonergic. For example, this is the serotonergic neuron. This is the presynaptic cleft, and this is the postsynaptic cleft over here. Okay. So here I have drawn the serotonergic neuron. Serotonergic neuron. Okay. And here I am drawing the noradrenergic neuron. Noradrenergic neuron. Okay. So again, this is the presynaptic cleft of this one, and this is the postsynaptic cleft, and this is of course the synaptic gap in both the cases. Now, actually, in the serotonergic neurons, the tryptophan converts into the serotonin. So what is happening over here? That tryptophan converts into the serotonin, which is 5-HT, 5-hydroxytryptamine, and those serotonin will start to accumulate inside the vesicles. Okay, here are these vesicles, and the serotonin, this one, will start to accumulate inside it, and on the onset of the action potential, they will release from these vesicles and will appear in the synaptic gap. Okay. Now, this postsynaptic cleft have some receptors. They have the serotonin receptors over here. Okay, these are the serotonin receptors, 5-HT receptors. Okay. So what is happening in the normal situation, in the normal humans like us, that tryptophan converts into the serotonin, and serotonin will be start accumulating in the vesicles, and they will on the onset of the action potential, they will release from these vesicles into the synaptic gap, and they will start accumulating over there and will start to bind onto these serotonin receptors, and will maintain the mood of the receptor. Actually, the serotonin is responsible for the mood of the person. Actually, it is responsible for the happy mood of the person, so that's why it is also called as a happy neurotransmitter. So this is the serotonin. But in the depression patients, the patients who are suffering from depression, they will due to some reason they will not be able to for example, tryptophan is not able to produce much amount of serotonin, or they are not able to accumulate in the synaptic gap in proper amount, or they are not able to uh, bind to these serotonin receptors so that proper action potential could generate through the postsynaptic gap. So there could be the many problems with the binding of the serotonins with the serotonin receptors. Now, if we talk about the noradrenergic neuron, this was about the serotonin, and if we talk about the noradrenergic neuron, so now I am going to talk about the norepinephrine. This was about the serotonin. Actually, here tyrosine converts into the norepinephrine, okay, and norepinephrine will start to accumulate again inside the synaptic vesicles. So this is I am drawing the synaptic vesicle, and here they will start accumulating. Okay, like this. Now, with the onset of the action potential, they will release into the synaptic gap. They will release into the synaptic gap, and they will start binding to the receptors. There are receptors like beta receptors, alpha 1 receptors over there. This is the beta, this is the alpha 1 receptor. Also, they have presynaptically, they have alpha 2 receptors, for example. Okay. So, they will start releasing into the synaptic gap and will start binding to these receptors. So, this is the normal condition. However, in the patients who are suffering from the depression, there will be the problems in binding of these norepinephrine with the receptors over here, or they are not secreting from these vesicles in the proper amount in the synaptic gap. Okay. Again, now one more situation is here, that this norepinephrine must be reuptake also. So they are reuptaken by some by some transmitters. Okay. So here I am drawing some transmitters like this. For example, this is the norepinephrine transmitter, which is responsible for the reuptake of this norepinephrine into the presynaptic gap, so that it could be further recycled by this mechanism. Again, in the serotonin also, there is some kind of transmitters which helps serotonin to reuptake. So this is the norepinephrine reuptake transmitters, and these are the serotonin reuptake transmitters. So serotonin reuptake transmitters. Okay. With the help of this, the serotonin will be able to get into the presynaptic gap, and physiologically they will be able to recycle again. Okay. And here we have some, you must have heard about this, we have some monoamine oxidase. So monoamine oxidase, what they are doing over there, that they will degrade, or they will destruct the extra amount of the neurotransmitter. For example, in the serotonin case, they will destruct the, or they will degrade the further serotonin which is not present in these vesicles. So here we have the monoamine oxidase also. Monoamine oxidase. Okay, we have two kinds of monoamine oxidase. Monoamine oxidase A, monoamine oxidase B. Monoamine oxidase A specifically they degrades these two, serotonin and norepinephrine, and monoamine oxidase B, they actually used to degrade the dopamine neurotransmitter. So here are monoamine oxidase which destroys the extra amount of the serotonin over there. Here also we have the monoamine oxidase. Okay, so this was about the physiological condition, what is happening in the normal human being. But in the case with the depression patients, these are not good, because already the amount of the serotonin or norepinephrine is already low in the synaptic gap, and further we have the serotonin reuptake transmitters and the norepinephrine reuptake transmitters. So they are taking the serotonins and norepinephrine into the presynaptic left, and further monoamino oxidase are also degrading those, and there will be the very low amount of the serotonin and norepinephrine in the synaptic gap. So the person will be depressed too much. So to prevent this situation, we have the antidepressant drugs, which binds to or blocks these receptors uh, with a different mechanism of action and helps the patient to get more and more neurotransmitters in the synaptic gap. So antidepressants, we have the 5 classes of drugs to prevent the depression. So what classes are these? First one we have uh, selective serotonin reuptake inhibitors, SSRI. Selective serotonin reuptake inhibitors. Second, we have serotonin norepinephrine reuptake inhibitors, SNRIs. So serotonin norepinephrine reuptake inhibitors. Third, we have the tricyclic antidepressants. Okay. So tricyclic antidepressants. Further, we have the monoamine oxidase inhibitors. So monoamine oxidase. Okay. Monoamine oxidase inhibitors, MAOIs. And fifth one, last one, we have the atypical antidepressants. Atypical antidepressants. Okay, so these are the 5 classes of the 5 major classes of the antidepressants through which the practitioners used to treat the depression patients. Okay, so how they work, how the mechanism of action, they, as far as uses are concerned, indications are concerned, they all are used for the depression. And also, if you talk about the SSRI, selective serotonin reuptake inhibitors, they are used for the generalized anxiety also. Okay, they are used for the generalized anxiety and they are used for the depression also. And if you talk about the adverse effects, further, SSRI, selective serotonin reuptake inhibitors, they are used for the post-traumatic disorders, as well as they can also be used for the obsessive compulsive disorder, which is very important. What is obsessive compulsive disorder? That these kind of persons are not be able to remember the things. So, and or you can say that they are forgetting the things in very short period of time. For example, if they took something, for example, they took their phones or not, they will forget it even in some seconds, or after a few seconds they check their things again and again. So this is the obsessive compulsive disorder. However, the syndrome is not the significant sign of the depression, but if obsessive compulsive disorder is seen in some people, they can be suffering from the depression. And adverse effects, they could be suffered from the insomnia, some kind of irritability. Okay, further with the overdose they can cause anxiety. Nausea, vomiting, diarrhea are more common as far as the GIT is concerned. And also in the spinal cord, due to the problems in the spinal cord with the overdose of these drugs, they can cause the erectile dysfunction also. Selective serotonin reuptake inhibitors. Now, how they work? How they work to get rid of the depression? So, selective serotonin reuptake inhibitors, as you can see, the selective serotonin. So, they will bind to these ones, serotonin reuptake inhibitors. They are the inhibitors of the reuptake transmitter. So, these serotonin reuptake transmitters will be blocked by these SSRIs. Okay, So they will be blocked by these SSRIs. So what will happen, that whatever amount of the serotonin was reuptaken by the presynaptic left through these transmitters, they will not be able to further take the serotonin into the presynaptic left anymore. So there will be the more accumulation of serotonin over here, and there will be the more chance of serotonin binding to these serotonin receptors. So uh, they could help in improving the mood of the person, or they could help in the person's improving from the depression. So this was about the selective serotonin reuptake inhibitors. Now let's talk about the serotonin norepinephrine reuptake inhibitors. How they work? They will work on the both the transmitters, so serotonin as well as norepinephrine. So they will block these ones, serotonin reuptake transmitters. So they will block these ones, as well as they will block these two. So they will block the serotonin reuptake transmitters, as well as they are going to block the norepinephrine transmitters. So by this, there will be the more and more accumulation of the serotonin in the synaptic gap, and here also there will be the more accumulation of the norepinephrine, and they will have the more chance for the binding of the norepinephrine to these receptors, and for the serotonin to the serotonin receptors, or 5-hydroxytryptamine receptors, which is the same. Now they are used for the depression, they are used for the anxiety, they can used for the associated fibromyalgia also, and some kind of neuropathies also. Adverse effects are the same with the SSRIs. Also they have the increased heart rate, and there could be the increased blood pressure or tachycardia. So there could be these kind of side effects with the serotonin norepinephrine reuptake inhibitors. Now let's move on to the tricyclic antidepressants. Okay, tricyclic antidepressants, what they do, that they are also used for the depression and anxiety as well, but they can block various kinds of receptors. For example, they can block the serotonin reuptake transmitters. Okay, they can block the norepinephrine reuptake transmitters, as well as they can block the alpha-1 receptors. They can block the cholinergic receptors, that is muscarinic receptors. They can block the histamine receptors. Okay, that's why they have more side effects as compared to their indications. So if they are binding to, you can understand that if they are binding to alpha-1 receptors, what kind of effect they can show? They will show the antiadrenergic effect, for example, dizziness, hypotension. So there could be the effect like this. If they will bind to the muscarinic receptor, that is cholinergic receptor, they can show the anticholinergic effects. For example, xerophthalmia, dry eyes, xerostomia, dry mouth, urinary retention. So these are some kind of anticholinergic effects. Further, with the binding of the histamine receptors in overdose, they can cause the sedation. Okay, the person will feel dizzy and they want to sleep. So these are some kind of adverse effects related to the tricyclic antidepressants. Moving on to the monoamine oxidase inhibitors. Now you can see here that monoamine oxidase are present over here. So what they will do, they will block these monoamine oxidase. So they are going to block these ones. Okay, so they will block these. Actually, these are the MAO, monoamine oxidase. So they are going to block these monoamine oxidase, and the function of monoamine oxidase was to degrade the amount of the serotonin or norepinephrine in the presynaptic lab. So if there will be not much degradation, as they will block these monoamine oxidase, so there will be the more and more accumulation of the serotonin and the norepinephrine in the neurons, and again they will have the more chance to bind with these receptors and help the person to get rid of the depression. Now there is one drug, actually there is one drug, that is siliglin, which is used to block the MAOB. Now, as I have told you that monoamine oxidase A, and there are monoamine oxidase A and monoamine oxidase B. Also, these monoamine oxidase are present in various organs. For example, in brain we have, as well as we have in the GIT also, okay, in the gut and other organs too. So, monoamine oxidase A used to degrade the serotonin and norepinephrine. So here we have the monoamine oxidase A. But in case of dopamine, monoamine oxidase B is there. So monoamine oxidase B is responsible for the degradation of the dopamine in the presynaptic left. Here I have not drawn the dopamine as I have drawn the mechanism of the dopamine in the previous videos. But there is drug siliglin. The name is siliglin, which is used to block the MAOB. Most of the monoamine oxidase inhibitors, they used to block the monoamine oxidase A, but there is one drug, that is siliglin, which is used to block the monoamine oxidase B. So there will be the more and more dopamine concentration as they will block this one, as they will block the monoamine oxidase B. Okay, so remember what happens in the Parkinson disease, that there are the low levels of the dopamine in the brain or the CNS. So as they are blocking the monoamine oxidase B, there will be the more amount of the dopamine in the neurons. So this drug siliglin also used to treat the patients with Parkinson disease. So this is the important fact about the siliglin, that they are the monoamine oxidase inhibitors, but they can be used for the Parkinson disease too, as they are elevating the level of the dopamine in the CNS. Now moving on to the tricyclic antidepressants. Actually, amitriptyline and norepinephrine, these are two drugs which are used for the neuropathic diseases or the fibromyalgia too. So amitriptyline and norepinephrine are important in the class of the tricyclic antidepressants. Also, there is one drug, doxepin. Doxepin is used for the insomnia also. And I have talked about two more drugs, that is amitriptyline and norepinephrine. These are the tricyclic antidepressants. Okay. Now, moving on to the atypical antidepressants. Atypical antidepressants also used to block various kinds of the receptors, as the tricyclic antidepressants do. You can make it easier by making it TCA, tricyclic antidepressants, like that. Okay. So moving on to atypical antidepressants, they also used to block the various kinds of receptors. So they also have the more side effects. Okay. For example, anticholinergic effects or anti-adrenergic effects, some sedative effects. But there is one drug, that is bupropion. Now, what is the function of the bupropion? That it will block the dopamine receptor, as well as it will block the norepinephrine neurotransmitters. So here I am writing it, bupropion. So what they are doing, they are blocking the dopamine and norepinephrine reuptake inhibitors. Okay, so they are blocking these ones. They're blocking the dopamine receptors and the norepinephrine reuptake inhibitors. This was the bupropion, which is the atypical antidepressant. Okay. Also, this is used for the depression, as well as they can be useful with the those patients who are taking on nicotine, and also for the withdrawal syndromes, bupropion can be used. Further, we have one more drug, that is trazodone or nifazodone. These two drugs used to bind to the histamine receptors, serotonin reuptake receptors, and they will block the serotonin reuptake inhibitors, and they will partially activate the serotonin receptors, so that there could be the more and more amount of the serotonin, and the person could feel better in case of depression. Also, we have the vilazodone, which partially stimulates the serotonin receptors and helps in this situation. And again, they have the many kinds of adverse effects, the side effects too, because they bind to the various kinds of receptors and causes various kinds of side effects. For example, antiadrenergic, anticholinergic, or sedative effect that is with the binding of the histamine receptors. So this was about the antidepressants, some basics in the antidepressants, and how they used to block various kinds of receptors, and they help the depression patients. So thank you for watching this video. I hope you like this, and see you in my next section. Thank you.